Good afternoon. Today is April 17th, and today I'll be continuing to be talking about the coronavirus. So the first piece of news that I'd like to talk about today is that the first warning of the devastation that the coronavirus could wreak inside American nursing homes came in late February when residents of a facility in suburban Seattle and Kirkland perished one by one. And in the 6 weeks after, large and shocking lethal outbreaks have continued to ravage homes across the nation. Now, a tally by the New York Times found that almost more than 6,900 people have died of the coronavirus, who are connected to nursing homes. So, everywhere in states, and this kind of a sign of the coronavirus wrecking nursing homes have already been seen in Seattle and in Britain, but here across America, about a fifth of the deaths from the virus in the United States have been tied to nursing homes or other long-term care facilities, and more than 36,000 residents and employees across the nation have contracted it. Since the virus is known to be more deadly to older, immune-compromised people, and in small, confined settings where the virus could easily spread, like nursing homes, the virus has absolutely just wreaked devastation all across. Workers frequently move from one room to the next in nursing homes, which make it the best setting for the virus to transfer. Oversights and failures have also contributed to the crisis, as more than 24 workers in long-term facilities show that the system of nursing homes is unequipped to handle the onslaught and disintegration further amid the growing virus. So another problem is that nursing homes just simply do not have the equipment, no testing, no equipment, and with so much dangerous high-risk people living in them, it's just absolutely devastating, as we did not protect the nursing homes, and the nursing homes are suffering because of it. The second thing that I'd like to talk about today is that in a new report from the United Nations has warned that the social and economic fallout of the pandemic risks make the most lasting consequences for the young. Researchers found that as schools remain closed, families lose income, and the health and needs of children go unmet. Hundreds or thousands of children could die, and millions could be plunged into poverty. It found out that the pandemic was turning into a broader child rights crisis, which means that children in the poorest countries and in the poorest neighborhoods and those that are already disadvantaged or vulnerable situations will only suffer more and more, as if adults can't even feed themselves, then how in the world are they going to feed children? And as the economy falls out, families lose income, often it's the children that suffers. Polio vaccination campaigns have also been suspended, along with measles immunization campaigns have stopped in at least 23 countries. Therefore, these children can't get vaccinations. They could be vulnerable to these diseases, and health services become more overwhelmed. Sick children are less able to access care, and in return, they may get sick and die. School closures, like I previously mentioned, reduce many children's nutrition and safety, as more than 310 million school children, nearly half of the world's total, rely on schools as a daily source of needs. And here, let's just hope that just give children some attention which they deserve, and give them food and nutrition which they also should deserve. The third thing that I'd like to talk about is that as ventilators begin going into shortage, they are one of the most important devices to help deliver oxygen into the patient to help keep them alive. In the United States, because fears of ventilator shortages have unleashed a wave of experimentation, which are leading to some promising alternatives to help sustain patients. Some hospitals have been using the machines CPAP and BiPAP machines, which are designed for people with sleep apnea to keep coronavirus patients breathing without having to resort to intubations and ventilators. Engineers have even transformed a hooded hair salon dryers into a personal negative pressure chambers that deliver oxygen and limit the spread of the virus. Pulmonologists across the country have been turning to a remarkably simple intervention, which is basically flipping patients onto their stomachs to improve oxygen levels for those in respiratory distress. So these interesting interventions are coming handy when equipment such as ventilators, which are so needed, go missing during a time like this, and it really brings out the creativity and collaboration during hospitals. And hopefully, maybe scientists can use this information learned here to use them further in the future when ventilators do go missing or go in shortage again. That's it. Thank you for listening, and I hope you have a good day.